Hi, welcome to week 5 of remote learning. This week we look at sleep and we'll look at art too as part of stress management. We touched on sleep earlier in the semester when we talked about circadian rhythm. Circadian rhythms are integral to our sleep-wake cycles. We'll look at some other factors related to sleep that can affect our health and wellness and stress management. Thursday I'll post the bit about art because that's going to be more activity based. A way for us to catch up on sleep. We'll also look at ideas for enhancing sleep and consideration of our own individual habits with sleep and stress management. Even though the amount of sleep is individual for each of us, genes influence that as well, but we can generalize sleep requirements based on age groups. From the chart from the Center for Disease Control, the CDC, number of hours changes throughout our lifespan. Also, as we age, our patterns of sleep may change. So take a look at that. The hours, kind of the range we're supposed to get as an adult, 7 or more, so that number of 7 is that critical piece, and that's kind of what the research looks at, and we'll be talking about that a little bit more. The other age group is teenagers, 8 to 10 hours of sleep per night, and with our schedules in a normal environment, are teenagers getting that? They may be more apt of getting that now during the pandemic. Is there such a thing as too much sleep in our American culture? Can be. Again, our bodies and minds seek balance. Too much or not enough may result in stress to our biological systems. Too much sleep can contribute to procrastination, boredom, and diminished focus. So, quality of sleep. The sleep that results in feeling refreshed in the morning includes multiple cycles of different stages of sleep. Disruption in these cycles or stages can lead to sleep deprivation. So we have this first category of non-REM or rapid eye movement sleep. And this has 3 to 4 cycles depending on who you look to. But we'll break it down into 3. Drifting, when you're just drifting off to sleep, that's a light sleep, you're easily woken up. Then you go into light sleep. And then that third stage of non-REM is deep sleep. Very difficult to wake up, no movement. And then we go into stage 4 or 5, rapid eye movement, which is a very active brain. Starts about 90 minutes into sleep and lasts about 60 minutes. And then we cycle through these stages, again, depending on who you read, anywhere between 4 to 6 times per night. Things that happen here during REM sleep is learning and memory is processed and consolidated, and we'll look at other things that happen as well. And cycles of stages change throughout the lifespan. We may spend more or less time in certain stages. What are some of the brain structures involved with sleep? We've seen some of them function as part of the hypothalamus pituitary adrenal axis with the stress response. Remember that, the HPA axis? A brief look at function in sleep provides an excellent example of how many roles that our structures, glands, and hormones play in homeostasis. Things do more than one job. So we have the hypothalamus and the brainstem that encases the limbic system. And the hypothalamus produces GABA, this gamma aminobutyric acid, and this decreases arousal. So we actually have hormones that decrease arousal. Stay tuned. During REM sleep, rapid eye movement sleep, the thalamus relays sensory information to the brain, and the amygdala, remember that's tied to emotion center, is active. Remember adenosine, that hormone, we talked about that the adenosine receptors, and caffeine blocks those receptors, so adenosine can't cause decreased arousal, and the caffeine can take in and cause increased arousal. So just thought that was interesting. And adenosine is active in decreasing arousal to prepare for sleep. So here's another picture of the brain showing some of the structures. You see the hypothalamus, you see the midbrain, or the brain stem, just to give you that visual picture. So again, there's neurons also in the area of the brain that release certain neurotransmitters, and these reduce activity in the arousal regions, amygdala, thalamus, hypothalamus, and that triggers us to go to sleep. But then we look at what triggers those. So just a reminder, biological mechanisms of sleep include the circadian rhythm, and that's based on that 24-25 hour or so cycle, and our sleep drive. Yeah, we actually have mechanisms, built-in biological mechanism that drive us or push us to sleep or compel us to seek sleep. We may be tempted to think of sleep, a full night's sleep, as a luxury, as non-necessary way to spend a third of our life. But sleep is necessary for survival, and we have that built-in drive. So here we look at the reminder, the circadian rhythm, the cycle. We have the environmental triggers, light and dark. Also melatonin, produced by the pineal gland in the brain, is involved in that circadian rhythm. And then our sleep-wake homeostasis, or sleep drive, is built on stimulating the sleep response, and our sleep drive becomes stronger the longer we are awake. So as soon as you wake up this morning, our sleep drive is very minute, but as the day goes on, it becomes stronger. So effects of quality of sleep. What are some of the benefits? Yes, our bodies definitely get to rest, but there's more. And one of the TED Talk videos will talk about that a little bit. All the biochemical processes, especially in the brain, have byproducts to them. And what happens to those byproducts is they need to be cleaned up, if you will. So sleep promotes and allows those processes to clean up the biochemical waste, if you will, things left over from our biochemical responses. There's also, sleep provides the opportunity for memory consolidation, and tie this to the hippocampus as one structure. Remember way back at the beginning of the semester in the video with Sobolski about stress, and the idea of pulling an all-nighter for studying messes with your hippocampus and your memory, and things that you think you would know, you don't remember, you don't know. So that's a piece of that. And then when we're sleeping, there's a decrease of energy, so it gives our system that break. Now, what's the impact of stress on the quality of sleep? Well, it really ties closely with the effects on our body, right? And those things can contribute on quality of sleep. So definitely when we're feeling stressed, our normal cycles of sleep can be disrupted. It can also prevent falling asleep and staying asleep when we wake up with a worrisome thought and we can't get back to sleep. Also, chronic stress disrupts sleep, and these are some of the effects affecting metabolism, which can result in weight gain, contributing to obesity, constant blood levels of cortisol and other hormones, so we kind of have the ongoing stress response, which can contribute to heart disease. And that's kind of the long-term effect of disrupted sleep from stress. And then decreased insulin sensitivity, contributing to type 2 diabetes. So remember, if we have decreased insulin sensitivity, it means our insulin isn't doing its job to pick up the extra glucose in our bloodstream. So this back and forth relationship, the stress effects on quality of sleep. As soon as we go into sleep deprivation, we see those chronic effects, if you will. So not only stress affects quality of sleep, but the other things that affect quality of sleep as well can result in these chronic problems. A quick look at insomnia. Insomnia is the inability to fall asleep, whether initially or after waking up during the night. We may go through periods of insomnia during stressful times, experience short-term effects such as irritableness, difficulty focusing, to more long-term effects of affecting job performance, and of course safety. Drowsy driving and falling asleep while driving are critical safety features that we see car accidents cause from. So let's look at this for a second for underlying causes of sleep deprivation. There can be medical conditions, things going on that we do that can contribute to us not getting enough sleep. So we could have some sort of sleep disorder such as insomnia, sleep apnea, narcolepsy, or restless leg syndrome. Medications can contribute to poor sleep or disrupted sleep. So, for example, some high blood pressure medications, depression, chronic pain, cancer, those types of medical conditions can contribute to poor quality sleep. And of course, there's more. So we have some immediate effects and chronic effects of sleep deprivation. We've all probably experienced at least the immediate effects where we haven't slept well for a night or a few nights, and we kind of have a foggy brain the rest of that day. Remember the memory piece and the hippocampus. I talked about that before. Also, we're kind of cranky. We might be real tired the next day, not getting enough sleep, and our performance isn't at its best. Chronic sleep deprivation. Remember, in addition to disrupting the normal process that happens during sleep, sleep deprivation is a stressor, and so will impact as a stressor as well. So our performance affected. If you've ever experienced micro sleeps where you nod off and it lasts for a few seconds, you basically fall asleep, or heaven forbid, while driving. I know that happens to me sometimes if I'm taking evening class. I'll fall asleep sitting up. Sometimes it lasts more than a few seconds though. Our immunity can be affected. Insulin sensitivity decreased, which over time that leads to risk for type 2 diabetes, heart disease, obesity, and depression. So can we catch up with sleep? Not really. We can't really make up the 10 missed hours during the week that we missed during the week by sleeping longer on the weekend. We can probably do it numbers wise, but those extra hours on the weekend don't seem to change the biological effects related to metabolism, weight gain, insulin sensitivity. So we can't really regain them, but what we can do is stop that and get back on schedule with our sleep pattern. Think about anybody doing shift work, especially if that shift work rotates from nighttime to third shift to morning. Somebody's sleep cycle is really going to change, however that cycle is. Somebody who's on constant night shift can still have the side effects of some effects of sleep deprivation. Also, parents of newborns and children, somebody with medical conditions that promote disruptive sleep. So we have these other things that maybe we have limited control over, but catching up on sleep, it may provide a little like mini vacation or allow us to rest, but some of the biological things aren't caught up by catching up on sleep. So napping. Is napping beneficial? It actually can be. Pre-planning a nap ahead of a late night, emergency napping when you are head nodding and feeling very tired during the day, or whether that napping is part of a daily schedule, can promote alertness and performance. Now, there's some caveat to pay attention to the duration of the nap. Shorter naps are better. Naps that are 10 to 20 minutes seem to promote positive effects of alertness, improve performance. Longer nap times can result in something called sleep inertia, where we might be possibly sleeping longer to actually enter some deeper stages of sleep. And sleep inertia results in being groggy, difficult to wake up, you're actually less alert, your performance may be worse. Also, keep in mind that napping later in the day could disrupt your normal nighttime sleep. So, what are some strategies for improving sleep? Figure out how much sleep we need. So, invest in when do you feel your best? How many hours is that? And that might be doing a schedule of sleep and kind of playing with that a little bit. Trying to keep a consistent wake-sleep schedule, not having that shift and change when we have a typical weekend or something where we stay up really late and wake up late. Try to keep your sleeping and waking schedule consistent. The sleep environment, including temperature, darkness, blue lights or lights from technology in the rooms, those types of things. We actually do better sleeping in a slightly cooler room, complete darkness, and then any blue lights or lights in the room can disrupt our sleep. That affects the potential visual piece, even with our eyelids closed, that relay to the brain. Also, calming thoughts. It sounds so easy. Calm thoughts before bedtime. Quiet your mind. And the good thing is you know some strategies for this. Decreasing stimulation before bed, an hour or so before, no Facebook, no TV. Sometimes that's harder to do than to say. Avoiding eating an hour or two before bed. And then some things that might work to help prepare for sleep: a warm bath, warm shower, light exercise, again, not too close to when you're actually going to sleep, and the relaxation techniques. Some of you have already mentioned that some of the meditation actually contributes to you falling asleep. So if that happens, that's okay to use meditation that way. Sometimes getting up and doing a quiet activity, if you've woken up in the middle of the night and can't get back to sleep, sometimes it's helpful just to get up and use the time rather than worrying about the sleep that you've lost. And finally, make sleep a priority and a necessity. So changing our attitude towards sleep. And remember, something is something. So start, just as we've talked about all semester, make a small change, make that a habit, then add in more changes. If sleep deprivation is chronic, speak to your medical provider for more help with that. These are the resources used to help make this PowerPoint. I'll see you on forum or virtual class. Remember to complete those guiding questions.